All right, thank you very much. Welcome to the Public Health and Minority Health Disparities Subcommittee. We have two chambers of one bill today. Before we get started, I just wanted to say thank you to the stakeholders, and particularly to Delegate Lewis, who met with the stakeholders since our last meeting to get to consensus. And my understanding is that we have consensus on these bills. So with that, I am going to turn it over to Aaron and Delegate Lewis to talk us through what we've done, what we've agreed upon, and see if we can move these bills today.
Thank you, Madam Chair. Aaron, would you take the lead on explaining the bill? Thank you.
A reprint has been provided. The bill as amended would require a healthcare provider or healthcare facility to provide to a local team for a local maternal mortality review team on the request of the chair, with prompt access to all relevant medical records associated with the case review by the maternal mortality review program without undue delay.
And Delegate Lewis, would you like to move the amendments?
Thank you, Madam Chair. First, I would like to thank the City of Baltimore, the City Health Department, and all of the stakeholders and advocates who came to the table and in good spirits and with good faith came to a consensus. So we have a good bill. I also, Madam Chair, if you would indulge me, I'd like to say that we understand that any human pursuit is imperfect. And despite our best efforts, we might still need to come back and make sure that the City Health Department and the Maternal Mortality Review Team has access to the information it needs to deliver its annual report and really make a difference in the lives and health of women. So I want to recommit myself here to the Maternal Mortality local team, the City Health Department, and stakeholders, that I will be here with you if we need to come back and streamline our efforts. Okay, so with that, thank you. Madam Chair, I would move the amendment.
Thank you. That on House Bill 876 and Senate Bill 644, because we are amending them the same. Is that correct, Aaron? All right, so we can move both sets of amendments simultaneously. All right, amendments have been moved and seconded. Do we have questions from the members or anyone who wants to be heard on this bill? Delegate Riley.
So then what I'm hearing is that the folks that were in opposition, I believe it was MedChi and the Maryland Department of Health, they're good with this amendment as well, as Delegate Lewis said. Are they here to speak of that, or we're all good?
They are here.
Yeah.
Yeah, it's Pam, and I just wanted to say very quickly to not hold up your time. Yes, we're good with the amendments.
Thank you. Thank you, Madam Chair.
Thank you. Any other questions? All right, amendments have been moved and second. Oh, Delegate Alston.
It's just a quick one for council. This applies statewide. It's not only for Baltimore City, correct?
It would, but Baltimore City is currently the only jurisdiction that has a maternal mortality review team.
Thank you.
Thank you, Delegate Alston. Any further questions? Anyone want to be heard? All right, all in favor of the amendment, say aye. Aye. Anyone opposed? Go ahead and raise your hand. All right, the amendments have been moved. Do I have a motion on the
bill as amended?
Second.
All right, House Bill 876 and Senate Bill 644 have been moved as amended. Any further discussion? All right, then all in favor say aye. Aye. Anyone opposed? Go ahead and raise your hand. Both bills pass unanimously from subcommittee. That ends our work in subcommittee. So thank you all so much. Thank you, Delegate Lewis, and to all of our stakeholders. I know you worked in good faith to get us to consensus and made our work in the subcommittee really easy today on a day that's going to be very, very long. So thank you very much. With that, can I have a motion to adjourn?
Motion to adjourn.
Second.
All right, it's been moved and seconded. Enjoy the rest of your day. We will see you at 1:10 for voting. Is that correct? All right, we'll see you at 1:10 for voting.